Hello everyone. In this video, let us learn about intervertebral disc prolapse and how to treat it. Now, the aim of this video is not to gather information about the problem intervertebral disc prolapse, but the aim of the video is to give you information as to how you can get rid of the problem or how best you can get rid of the problem. To get rid of the problem means you should become symptom free as much as possible. So the aim is to get rid of the problem of intervertebral disc disease and to become much healthy and to become much more symptom free in this disease. So let us understand what this intervertebral disc problem is. The intervertebral disc prolapse happens whenever there is a prolapse of the gel-like material which is there in the discs. The discs which are there in between the vertebrae will have a gel-like material in the center. Whenever there is a wear and tear or because of stress and strain, the gel-like material sometimes protrudes out and it causes pressure on the structures around it, like the nerves. So the person will develop the symptoms, the pain, numbness, tingling and all these symptoms. This is how the person with intervertebral disc prolapse presents. In simple terms, we can call it as sciatica if at all this problem occurs in the lumbar spine. So what are we dealing today with? We are dealing today with intervertebral disc prolapse in the lumbar region, which is also, in other words, a kind of disease which will produce sciatic symptoms. Now, why do people develop the intervertebral disc prolapse? What are the causes? The common reason is wear and tear. If a person keeps on bending, lifting weights and doing twisting and twirling movements, then the person can develop intervertebral disc prolapse easily. And there are some genetic predispositions also where few people, because of the genetic predisposition, can develop intervertebral disc prolapse. Obesity is a very big reason. People who are obese can develop intervertebral disc prolapse, and people who are having sedentary lifestyle because of the weakness in the muscles secondary to the sedentary lifestyle also can develop intervertebral disc prolapse. And what are the symptoms of intervertebral disc prolapse? The symptoms of intervertebral disc prolapse in the lumbar region, in the lower back, would be pain in the lower back. If the disc prolapse occurs in the lower back, the person will develop pain in the lower back, and the pain may sometimes radiate to one of the legs, and we call it as sciatica. And the pain can be a shooting kind of pain, severe pain, or it can be a burning kind of pain, or sometimes there can be numbness, there can be tingling sensation, pins and needle sensation. So all these symptoms develop and they trouble the person. And over a period of time, if the person doesn't go for the medical treatment immediately, over a period of time, the disc prolapse can cause loss of the bowel and bladder function, which means that the person will not be able to hold the urine properly and will not be able to hold the stool properly. So he'll be having bowel and bladder dysfunction. So what are the treatment modalities available for intervertebral disc prolapse, or in simple terms, disc prolapse disease? There are non-surgical and surgical options available. The non-surgical options are the first things which doctors will advise because surgery is required for severe symptoms and severe cases. And the non-surgical modalities are: number one, going for physiotherapy. Physiotherapy strengthens the muscles, so it has to be done. And number two, painkillers, NSAIDs. Using the painkillers over a period of time will relieve you from the symptoms, so you can use the painkillers. And muscle relaxants also can be tried. Muscle relaxants will help you by relieving the spasm in the muscles, and sometimes corticosteroid tablets or spine injections, the steroid injections in the spine also can help you. Now, what are the surgical interventions? When we come to the surgical interventions, if at all the person has severe symptoms over a long period of time, then the doctors will advise surgical intervention. If the symptoms are severe, like if there is any numbness, if there is any weakness of the limb, in such kind of scenarios, patient should immediately undergo surgery. Now, discectomy, laminectomy, spinal fusion surgeries, these are the kinds of surgeries which are generally done. Nowadays, minimal invasive surgeries also are available. So it's the decision of the patient and the decision of the doctor together, whereby the patient can decide to go for the surgery or to manage the disease with non-surgical methods. Coming to the side effects of the medicines, we know generally that painkillers cannot be used for longer period of time because painkillers will cause ulcers in the stomach, they can cause acidity, and over a period of time painkillers can cause kidney failure. Steroids also can cause side effects like water retention, and long run steroid usage can to a certain extent cause bone resorption and osteoporosis, and it can also cause ulcers in the stomach and water retention, worsening of hypertension and diabetes. These are the common side effects with steroids. Coming to the muscle relaxants, if you use muscle relaxants for longer period of time, you may develop drowsiness and dullness. These are the common side effects associated with these medicines. But should you be afraid of the tablets because long run usage has got some side effects? Not at all. When the doctors give you medicines, you better use them because using them for little period of time will not harm you much. So you can certainly use them, but only under proper medical supervision. Now, what kind of food should you take if you have disc prolapse? You need to take food rich in calcium, you need to take food rich in magnesium, and you need to take food rich in vitamin D. You have to check whether you have vitamin D deficiency, and if you have vitamin D deficiency, you have to definitely take vitamin D. And along with this, you better start to analyze whether you have osteoporosis. Ask your doctor to check whether you have got any bone weakness, osteoporosis. And if you have osteoporosis or osteopenia, and if you have disc prolapse, your symptoms may become worse. You may feel excessive symptoms because of the weakness of the bone. So you have to discuss with the doctor whether you have osteoporosis or osteopenia, which means bone weakness. And some lifestyle changes also you need to do. You need to exercise regularly. You need to exercise low impact exercises like simple walking, swimming, or cycling. These kind of low impact exercises you should do. You cannot go for weightlifting or exercises where you need to strain and struggle. You should not do those exercises. And not only that, when you sit or when you stand, never try to crack your joints by twisting your spine like that. It will hurt your back, it will harm your spine. The disc prolapse can become worse. So no twisting kind of movements to be given when you have disc prolapse. You need to be careful. Avoid forward bending, avoid lifting of weights, avoid climbing stairs. These precautions also you have to take. Now, if you don't take precautions and if you don't take proper medical help immediately, what are the complications that can happen? The disc problem can cause chronic pain. You may experience severe back pain, and the back pain may be radiating into the limbs, and there may be tingling numbness which will develop over the limbs, and over a period of time there may be loss of sensation and loss of movement and weakness of the muscles, and weakness felt in the limbs, weakness in the legs, and loss of function of the bowel and bladder, as I already told you. So because of all these impending future complications, better get treated immediately with proper medical intervention. Now, you may say that, doctor, I've been doing all these things since long. I've been taking medicines, I've been doing the simple aerobic exercises, and I've been careful. I've been taking the physiotherapy, and I've been checking my vitamin D, my magnesium, my calcium, all these things, but still I'm suffering with the disease. You may say that. So remember, If you are obese, please try to shut down the weight. There are very good methods to shut down the weight. You can easily shut down weight with diet therapy also. You can opt for ketotherapy, carnivore therapy. With these diets, you can easily shut down weight and you can become much more lighter and you can become symptom free. Now, even after doing all these things, if you are symptomatic, now remember, our goal is not to know about disc disease, but our goal is to get rid of the disease as soon as possible. So after doing all these things also, if you have the disease still persisting, then I, being a doctor in homeopathy also, I advise homeopathy for you, because there are very good remedies in homeopathy which can relieve you from the symptoms of disc disease and which can help you to become symptomatically much better from the disc disease. So you can definitely opt for homeopathy along with allopathy and along with the diet therapy. You can surely use homeopathy. There are patients who came to me with disc disease, and after using homeopathy along with the regular precautions and necessary allopathic medication, they became much better. Use homeopathy for about 6 months or so. You will see a great result in disc disease. So if you have disc disease, intervertebral disc prolapse, no need to panic, no need to get dejected, no need to feel sad. You can become much better within 6 months with all these precautions, and you can aim to become better. So this is about intervertebral disc disease and how to become better with integrative medicine using these all methodologies. And if you know any more method with which a person can become better who is suffering with intervertebral disc disease, you can surely let us know in the comments, and you can help others by letting your knowledge known through the comments. Many people can get benefited if you can share your knowledge and experience with the disease. You can surely share your data, your knowledge, data of your knowledge in the comment section, so that you also can benefit people at large. Thank you.